Hello and welcome to Dr. Brainwaves. I'm Dr. Susan Raschal and this is Dr. Rena Azar. We decided to bring up an important issue that we are unfortunately seeing more and more cancers related to human papillomavirus. So we felt it was very important to talk about the HPV vaccine.
So we just really wanted to say just a brief little description of what HPV is. HPV is the human papillomavirus. It is a virus that's been around a long time. It is a virus that causes cancer. Not definitely with exposure, but in some people who have been exposed. We do not do very well at predicting who exactly will have this virus allow them to get a cancer versus what people's immune systems can fight it off. We do know, however, because it is not common in nuns, that it is a sexually transmitted disease, essentially. So the important thing about the HPV vaccine is that it helps to prevent some things that are very problematic for people. I think everybody knows that it's linked to cancer, but perhaps not everybody knows that it's linked to genital warts, which is an annoying and problematic and embarrassing symptom.
And difficult to treat.
Absolutely. And also HPV is linked to the cancers not just in the female and male genital tract, including the cervix, the vagina, the vulva. It's also related to anal cancer. It's related to penile cancer. And it's related to cancer of the tonsils, the throat, the tongue, and areas of what we call the oropharynx. So those cancers are all largely caused by the HPV virus.
And we're seeing more and more people who have been afflicted with this, who now have developed these HPV-induced cancers that are in their 30s and 40s.
Absolutely.
So that's why the vaccine may play a very critical part in preventing these cancers.
Absolutely. In addition, the inconvenience of getting an abnormal pap smear, for example, and having to come repetitively for repeat examination and testing to make sure that those abnormal cells go away can be avoided with the HPV vaccine. The HPV vaccine is authorized for people from 9 to 45 years of age. I think that's a really good consideration. We used to say it was just for younger people, but we recognize now that more and more people are getting out and dating as they get older and becoming sexually active with multiple partners even as they're older. And that has to do with people losing loved ones and starting to date, people getting divorces or separating from an important relationship and getting out there and dating more. And they are also at risk. So we're encouraging people to get that vaccine up to 45 years of age. We have some new information about the vaccine immunization series that people have received in the past that perhaps have not completed the series. They don't have to repeat the whole series. So see your doctor to see what immunization you need, whether you need one more injection, 2 more injections, 3 more injections for you or your child. We're strongly encouraging that. There are very few people that have any kind of anaphylactic reaction to that. The number one symptoms that people get related to that vaccination is just a little pain at the site of the immunization, occasionally dizziness, fainting, nausea, or headaches, which we see with any immunization.
Sure. But the large local reactions are very common, and typically we tell people to apply ice to them, take either Tylenol or an NSAID, like ibuprofen or something that will also help relieve that discomfort.
Contraindications are hypersensitivity to the components.
And explain to them what contraindications means.
It means the people who should not take it or should perhaps get counseling, medical counseling before they consider taking it.
And those contraindications you said
hypersensitivity, a known hypersensitivity, like you've had your first immunization of the series and you had a reaction to it. So
a life-threatening reaction.
Absolutely.
Yeah, not just a side effect from the medicine. Like a large local reaction would not be considered anaphylaxis, even though the skin is involved.
And relative contraindications, which means not that you can't have the immunization, but seek some medical counsel about whether it's appropriate for you to receive this immunization, would include a yeast hypersensitivity, pregnancy, currently, immunocompromised, or acute illness.
And part of the issue with the immunocompromised is that one of the things that we have learned over the years is that anyone who is immunocompromised and they get a vaccine, the vaccine just may not be as effective. So the efficacy may be lessened because of their immunocompromised status. And part of the reason why they recommend, especially people at age 9, to get it is because we know that, unfortunately, people are having sexual activity at an earlier age, and they've done the studies on this to see that even at this age that the vaccine is relatively safe.
Right. And that's the time to get the vaccine. The vaccine is an immunization against multiple members of the HPV family, but it does not mean that if you've already been sexually active, you shouldn't get it.
Yeah.
Obviously, you are likely to have not gotten exposure to all of the members of that family. So at any age, it is indicated within that age range, 9 to 45 years of age.
And I would say, again, we can't overemphasize the fact that HPV can lead to cancer. And like Dr. Azar said, not just the reproductive areas or the reproductive organs, but also head and neck cancers, the tonsil tissue, the tongue, and the larynx, back of the throat.
So thanks again, and we'll see you soon.
#anaphylaxis.